Come in.
Hello, are you here to take Diamond home?
Yes.
Okay, I have some take-home instructions and some information about medication and such to go over before I bring her in. So I'm sure you're aware Diamond has had an ovarian hysterectomy today, also commonly known as a staying. And this is the procedure of having both ovaries and the uterus removed. So there's no chance of her being able to get pregnant anymore. She can't go into heat. There also is very much less chance of her developing breast cancer. So that is also a good thing from this. Most dogs really do quite well after this type of surgery. Diamond's actually in recovery right now. Did very well during the procedure. No complications. She's pretty alert and awake right now. But for whatever reason, if you guys get home and you notice something that just seems out of the blue, you can just give us a call and let us know what's going on. So you just want to look for her regular activity should be back to normal. She should be feeling good. She shouldn't be too lethargic. She should have a good appetite, and you don't want to see any vomiting. So if you do notice anything like that, give us a call, bring her back in. We can set up an appointment for you guys. You also want to be checking the incision site, so no redness, no swelling, no discharge coming from the incision site. So if you do notice any of that, you can give us a call as well. I also, before I bring her in, I just have something to let you know. It is important to restrict her activity for the first week or so, maybe 7 to 10 days. So no running, no jumping, no rough housing. If you do notice, if you have another dog that they're usually pretty active together, try to keep them separated. You don't want them to overdo it and cause any complications with the incision site. Also try to avoid stairs as much as possible. If you do have like a locked outside or going downstairs, just carry her up and down. Usually we find if you're able to put her in a kennel, if she is usually pretty active at home, just place her in there for some restraint every now and then just to calm her down. But if she is usually pretty calm at home, she should be okay to just stay outside, stay outside the kennel. But also if you're going to be going outside for bathroom breaks, quick in and out, maybe just leashed walks outside just so she doesn't be running around or anything like that.
Okay.
Do you have any questions right now with anything before I go grab her?
No.
Okay, be right back. Okay.
Anyway.
Okay. Okay. So we'll be sending some medications home with Diamond. This is called Rimadyl. It is a pain medication that we do ask you to give her by mouth 2 times a day for 4 days. The instructions are written on here on the bottle as well as in the take-home instructions that will be going home with you. I can actually give you one right now just to kind of show you how it goes. It is a chewable tablet, so she should be able to take it pretty easily. If she tends to hesitate, you can always wrap it in like a pill pocket, deli meat, cheese, anything like that, but looks like she shouldn't have any issues with that. So we'll be sending that home with you.
Alright.
And then I think the last thing I just want to make sure that you know is to check her incision daily, maybe even a couple times a day depending on her activity levels. You just want to make sure you don't notice any of that redness or swelling near the incision site. And then you want to make sure she's not messing with it as well by chewing at it or licking at it. We do have e-collars if you've ever kind of dealt with those before. I have one here that I can kind of show you how it works.
Okay.
Okay, so once you wrap it and kind of latch it up, it forms this cone shape here. And this will wrap right around her neck just to prevent her from reaching around and licking at the incision site. So most tend to hate it, but once they have it on for a couple hours, they get used to it pretty quickly. So I'll show you here how it works. Okay. And if you find that they're having trouble eating with it or kind of resting with it, you can definitely, it's okay. You can definitely keep it off for those short periods of time, but if she is messing with it, just keep it on throughout the rest of the day. Also, Some other facts about the incision site, you want to make sure that it stays clean and dry for the next couple weeks. So don't clean it yourself. We don't usually recommend that because that could slow down the healing process. Once again, you don't want to see any of that redness or swelling. That could be signs of infection. And then no bathing, no swimming for the next couple weeks until those sutures come out, because once again we want that to stay dry. So do you have any questions right now about anything I just went over with you?
No.
Okay, perfect. And then in about 2 weeks we'll ask you guys to come back for a follow-up exam, just to recheck and get those sutures removed as well. There's no charge for that exam. That's just a follow-up exam
Okay.
that we'll provide for you guys, but you can just give us a call and set at the time that works best for you guys. That way we can get you in and out as soon as possible.
Alright.
And that's something you can set up with reception at the front desk on your way out. They should be able to take care of that for you pretty quick. Other than that, if you don't have any questions, I can get all this put together for you. And you guys should be good to head out.
Alright. Thank
Thanks so
you.
much. You're welcome.
Bye bye.